Welcome to my channel in the nursing science. Today I'm here with the topic medication safety and medication error. So if you guys are involved in health profession, I'm sure that you know the crucial part of health and science is medication, and I'm sure that you guys also know that medication error which happen most of the time in healthcare setting. So to avoid it, I'm here with some few measures sharing you guys in this video. So without further delaying it, let's get started. So for the safe medication practice, we all nurse have to be aware of three basic things, and they are the importance of medication safety, the cause of medication error, and the measures how to avoid medication error. So I want to give more focus on those three things in this video. We have to know the importance of medication safety. It is important because the first treatment measure which happen in healthcare setting is medication. However, we also know that the most common incident which happen in healthcare setting is medication error. So if we are involved in health profession, that we know that the consequences of having medication error is very costly in terms of person health and in terms of career. So it is very important to know about medication safety, the causes, and how to avoid it. So while talking about medication safety and the cause of medication error, I would like to focus on four major factors that will lead to medication error, and those four major factor that will lead to medication error is patient knowledge. Second one is documentation. Third one is a person who will prescribe medicine, for example doctor or nurse who will involve in medication administration, and the last one is environmental factor. There are many more factors that can lead to medication error, but as per the research from my self experience and from the book that I have studied, I found these four major factors are those which has shown in the screen as well. So at the same time, I would like to give a brief explanation on each of those factors. So the first one is passive knowledge. From the passive knowledge, what I mean is like how's the condition of patient, how's the solving ability of patient, how's the understanding of patient in terms of medication, and how's the communication of patients. These factor might also affect the medication safe practice. The second one is documentation. We all know that documentation is the most important thing while doing medication. So for the safe medication practice, we have to make sure that the documentation is in the condition which is understandable. So it has to consist all the rights of medication. So that's for example right person, right dose, right frequency, right time, and all those right of medication need to be clearly stated from the documentation. So that's that. And the third one is medical practitioner. So in terms of medical practitioner, I just want to give you a explanation. From the medical practitioner, what I mean is doctor or nurses. Doctors, physician, are the one who will prescribe medication and the medication chart, and the nurses are the one who will give that medication. So if the medical practitioner or a health professional who is involved in medication administration is tired or is in stress or get distracted, then this will lead to medication error, obviously. So the last but not least is environmental factor. So from the environmental factor, if the place where we are giving medication to the patient, if it is too noisy, if it is too crowded, if it is highly risk of getting distracted, then it might lead to medication error. And there are so many incidents which has happened from the environmental factor. So those all are the four major things that will lead to medication error, and we have to be mindful of about it. So if we can be away from those factors, we will for sure will give a safe medication to the patient. Last but not least, how to avoid medication in nursing. So the first measure that we can apply that to avoid medication error in our day-to-day practice in the field of nursing, the first measure we can apply is always be mindful about the approved abbreviation for medication. So there are universally acceptable terms for dose, frequency, time, and route of administration for medication. So for example, the acceptable abbreviation for time is like for BD, which stands for twice a day, TDS, it stands for thrice a day. So there are so many sources where you can find the universally acceptable terms for administration of medication. So you can refer to that, and for example, I can show you acceptable abbreviation for route of administration are intramuscular. It can be written as IM. For nasogastric route can be written as NG. So these are the few example for acceptable abbreviation for route of administration. So if you could get some idea, like for the universally acceptable terms for dose, frequency, time, and all for the medication administration, you will be conscious about error prone frequency and doses abbreviation. So that might help you to be away from medication error. So the second one is the nurse, especially are the one who will involve in medication administration. So if the nurse have clear and concise idea about the right of medication, then it will first you helps in avoiding medication error. So there were like only five right of medication previously, but the things has been changed, and um, there are so many rights of administration that we have to be mindful about it. So if we can follow all those right of medication safety for the safe medication, then it will definitely help us to prevent medication error. And those right of medication are right of do we have right passing, right medication, right dose, right route, right time, right reason, right passing assessment, right documentation, right response. So those all are the right of medication safety. So it is important to know about the right of medication if you want to be away from medication error. So the third measure that we can be mindful of it is we must have at least basic knowledge about the high risk medication. So from um, from the term high risk medication, what I mean, there are some medication which is very costly and which can lead to a very complicated situation in patient health. So it might lead to a very complicated situation in patient health. So if we want to avoid that situation, or if we want to avoid that complication, we have to have at least basic knowledge about the high risk medication. So high risk medicine are anti-infective medicine, psychotropic medicine, all insulin, chemotherapy, epidural and intrathecal agent, and narcotics and sedatives. And some of the electrolytes like potassium, concentrated electrolytes. So we have to have at least basic knowledge about high risk medication. So if we know about that high risk medication, we can for sure avoid medication error. Last but not least measure to avoid medication error is always stick with the policy and protocol given by your organization or the place where you work. The policy and protocol might differ from each hospital or each organization, or might differ in each country, but always stick with the policy and protocol. And also do train yourself. I think in almost all hospital, the training for safe medication will be provided. So do follow the training, and you can self-learn from different. There are so many resources at this stage, so you can always refer to different sources. So continue doing self-learning. Last but least, we are in the last part of this video. So most important thing of this video is how to avoid medication error. So the first measure we can apply for medication error is we can always be aware about the acceptable terms for medication, acceptable abbreviation for the medication. So there are acceptable terms for dose, frequency, time, and route of medication administration. So if we are always be aware about this, or if you have ideas about the acceptable abbreviation, then we will be able to identify um, or we will be conscious about the either phone frequency, doses, and other abbreviations. So for example, BD. BD stand for twice a day in medication administration. TDS stand for 3 times a day. For example, for the administration of medication, route for the route, intramuscular will stand for IM, nasogastric stand for NG. So those are the few examples of abbreviation of medicine administration. Second one, what we can do is we have to know the right of medication. So there were five rights of medication previously, but it has been changed, and there are few more added on those five rights of medication. And those five rights of medication and those right of medication safety is right patient, right medication, right dose, right route, right time, right reason, right patient assessment, right documentation, right response. So those all are the right of medication. So if we could stick with those all right of medication, it will definitely lead to safe medication practice, and we will not be in trouble of getting medication error. So the third one is it is very important to know about the basic knowledge or ideas of high risk medication. So especially the nurse or the person who is involved in medicine administration. So the nurse has to be aware about the high risk medication. So high risk medicine include anti-infective, some electrolyte like concentrated electrolyte, potassium, psychotropic medicine, all insulin, narcotic and sedatives, epidural and intrathecal agent, neuromuscular blocking agent. So all those high risk medicine, we have to have a basic idea about it. We have to know about high risk medicine because it will lead to a complication in patient health if we do any medication error while doing this medicine. So to avoid those kind of complications in patient health, we have to have some basic idea or some basic knowledge about high risk medicine. And the last but not least, always stick with the policy and protocol given by your organization or hospital or wherever you work. I'm sure that all the hospital or all the organization will provide a safe medication practice training. So always do stick with those protocols and policies for medicine practice. And the other thing what we can do is to avoid medication error is right medicine calculation is also. So if we can like remember all those formula for medicine calculation, and if we follow those formula, if we are not sure about the dose, then it might help to avoid medication error. So guys, I'm at the end of this topic. I hope this will surely help you on safe medication practice, especially in the field of nursing. If you find it helpful, please comment below how do you find this video, and don't forget to give thumbs up, and please do subscribe the channel if you want to gather some knowledge in the field of nursing. Thank you for watching. I will see you on a new one.